All right, next chapter for 30-30. We're going to be talking about the elbow, wrist, and hand. First off, first joint, we got the humeral-ulnar joint. This is going to be attaching our humerus to our ulna. Some things to consider. That trochleae is going to be medial. Capitulum is going to be lateral. So our humerus and our ulna are going to be the main two bones that attach. Our radius doesn't really touch the humerus unless it's in a certain position from flexion. Our second joint, radial-ulnar joint. This is where our radius and ulna attach. So here's our elbow complex. We have humeral-ulnar, so humerus to ulna. Here we mainly get flexion and extension. We also have our radial-ulnar, radius and ulna. Here we're going to get pronation, supination. First muscle, biceps brachii. This is going to originate on the scapula. Our long head is going to be our supraglenoid tubercle. It's going to be located right there. Short head is going to attach to the coracoid process. Same attachment as the pec minor. It's going to insert on our radial tuberosity. It's going to be located right here. Actions of our bicep. It's going to be our prime mover of elbow flexion, supination, and it's going to be a synergist for shoulder flexion. It's weak, it doesn't give us too much, but it helps. The biceps actually cross three joints. So does anyone have an idea of what that might be called? It's a tri-articular muscle. So it's going to cross three joints. Pretty cool. Brachialis. This muscle originates on the distal half of our anterior humerus. Inserts on the coronoid process and ulnar tuberosity. It's going to be located right here on our ulna. Actions of our brachialis. This is going to be a synergist for elbow flexion. And that's about all it's going to help out with. Brachioradialis is one of our forearm muscles. This is a lateral muscle. Think of anatomical position, always bring it back. This muscle originates on the lateral condyloid ridge. It's going to be right here. It's going to insert on our radial styloid process. Again, this is a lateral muscle. Thinking anatomically. Actions of our brachioradialis. It's going to be a synergist to, again, elbow flexion. Pronation when we're in supination. And supination when we're in pronation. Next set of muscles, we're going to move to the posterior side. Triceps brachii. We have three different attachments here for the triceps. First one, our long head. This is going to originate right here, the infraglenoid tubercle. Medial head, this is going to be the distal 2/3 of the posterior humerus right here. And our short head, the superior half of the posterior humerus, right up here. These are all going to insert on the olecranon process. Our last muscle, the action of the tricep, is going to be our prime mover for elbow extension. Our long head can also be a synergist to shoulder extension, abduction, and horizontal abduction. Now our last muscle for the posterior humeral ulnar is going to be the anconeus. This muscle is going to originate on the posterior surface of the lateral condyle of the humerus. So it's going to originate right here, very small spot. It's going to insert at the posterior surface of the olecranon process of the ulna. So we have a tiny muscle right here near our elbow. It's going to help us out, give us a little bit of elbow extension.
All right, now we're going to move past our humeral-ulnar joint, distally down to our radial-ulnar joint. Okay, we talked about how biceps brachii assists in supination. What biceps brachii assists is supinator, okay, creative anatomy needs. Okay. The origin is on the lateral epicondyle of the humerus, so we're lateral here on the humerus, posterior, okay, and proximal lateral on the ulna slightly, okay, and then an insertion on the proximal third of the radius. Okay, if we have an insertion on the radius, it means that we can move the radius. Right, supinator is a lateral posterior radial ulnar joint, gives us a posterior rotation, okay, or supination. Okay, our only function from supinate. Okay. We move anterior onto the radial ulnar joint. Looking at that distal radial ulnar joint, we have Pronator Quadratus. Okay, Pronator Quadratus has a origin on the distal quarter of the ulna and insertion on the distal anterior radius. Okay, so these are distal anterior muscles with an insertion on the radius. Means we can rotate the radius. They're anterior, so that will cause a medial rotation or an internal rotation or pronation of the radial ulnar joint. Okay. Primary function, pronation. And as we don't cross any other joints, we have a uniarticular muscle, uniarticular function. And pronator teres helps with our more proximal radial ulnar joint. It has a origin on the medial epicondyle, so medial epicondyle on the humerus, an insertion on the proximal quarter of the radius, anterior and lateral. So we move across anterior from our humerus onto our radius. Primary function here is pronation, and because it's also anterior and crosses our humeral ulnar joint, we get some weak elbow flexion, so it will be a synergist for our elbow flexor group. Okay, now let's move down into our wrist and hand. Okay. We have many different movements, mostly are sagittal plane movements. Okay, so we're going to talk about the radiocarpal joint or our wrist joint. That's our condyloid joint where we have our frontal and sagittal plane movements. Our metacarpophalangeal joints, which are here between our metacarpals and our proximal phalanx. Okay, so we have flexion extension, abduction, adduction here. And last, at our interphalangeal joints, which are small hinge joints that allow flexion and extension. Okay. We have intrinsic hand muscles similar to our intrinsic shoulder joint muscles. Intrinsic hand muscles sit from the carpals or from the metacarpals and then move into the hand. Okay. How we name these muscles, okay. The insertion of the bone name, okay. And then the insertion on the digit that we connect to. So abductor digiti minimi, and it abducts the smallest digit. Abductor pollicis brevis, abducts or abducts the thumb. A pollicis is our word for thumb when we're looking at our hand anatomy. The adductor pollicis, adducts our thumb. Opponens digiti minimi brings our smallest digit into opposition or across the hand. Opponens pollicis brings with opposition of our thumb. And if we look to the extrinsic hand muscles, we can look posterior first, extensor carpi radialis brevis, lots of words here, but extends the carpals on the radial side and is a small muscle, so we have wrist extension as well as radial deviation. And with extensor carpi radialis longus, this is a longer muscle. It has a more superior, more proximal origin point, same actions. Okay. Extensor carpi ulnaris is on the ulnar aspect, and it performs extension of the carpals, so wrist extension, and ulnaris, ulnar deviation. Okay, that naming gives us our location, and it helps us infer our action. We're not going to go through all of the exact origins and insertions for all of these smaller muscles. Okay, extensor digiti minimi extends the smallest finger. Extensor digitorum extends the 4 digits, digits 2 through 5. Extensor indicus is special because it allows extension of just our index finger or our first finger. Okay, and then extensor pollicis brevis helps us extend our thumb. This is our thumbs up muscle. Okay, give yourself a thumbs up for getting this far so far in this class. All right, and then extensor pollicis longus helps out with extensor pollicis brevis, so give yourself 2 thumbs up. All right, all of these extrinsic, posterior, carpal, and interphalangeal joints are moved through these muscles that have their origin extrinsically to both the carpals or the wrist and to the humeral ulnar joint because they have origins on our distal lateral humerus. A distal lateral humerus, so all of these extensors will also assist in extension at the humeral ulnar joint, so they will be synergist slightly when it comes to elbow extension. Okay, some have posterior radius, those brevis muscles have a more distal origin point. Okay, but we just need to know they have proximal origin and some cross onto our humerus. Then they all have an insertion on the digit or the region that we named in that muscle's name. So understanding this, knowing this, I want you pause the video and go through your notes, go through your book if you need it, try to infer all of these movements, or you just go back to when I told you what all the movements were, and list out the movements on your own as best you can. All right, now let's move anterior. Okay, so we have similar extrinsic anterior wrist and interphalangeal muscles, or carpal muscles, okay, and interphalangeal muscles. Flexor carpi radialis flexes the carpus or flexes the wrist on the radial side, so it will also assist in radial deviation. Flexor carpi ulnaris, wrist flexion and ulnar deviation. Flexor digitorum profundus is a flexor for our interphalangeal joints. Flexor digiti minimi allows us to flex our smallest finger individually from the rest of our digits. Flexor digitorum superficialis sits superficial, okay, and allows flexion of those digits. Flexor pollicis brevis helps us flex our pollicis or our thumb. Flexor pollicis longus, a synergist for thumb flexion. All right? Now all of these extrinsic hand muscles, similar to our extrinsic posterior or extensors, they have an origin on the distal medial humerus. So extensors at the wrist and the hand have a lateral and lateral distal humerus origin. Flexors, distal medial humerus origin. Okay, so extensors are lateral, flexors are medial. Key, think about it, make sure that we have that written down, make sure we remember that. Okay, their insertion is on the digit or the region named and will help us with that movement that we're trying to figure out. So, similar to what you did with your extensors or your posterior wrist and interphalangeal muscles, I want you to go through the extrinsic anterior muscles, go through each of their movements, and maybe try to see which ones are synergists, which ones work together, which ones are antagonists, work against each other, okay, and understand some movements, some activities that you would use these wrist flexors as well as the wrist extensors and the radial ulnar deviators. Okay. Palmaris longus is a special one. Palmaris longus does not cross our metacarpophalangeal or interphalangeal joints. Okay, so this one only crosses the wrist joint or the radiocarpal joint. Okay, we have an origin on the medial epicondyle of the humerus. Remember, medial for our wrist flexors, a medial humerus, and an insertion on the distal ends or kind of our anterior knuckles, okay, or our metacarpal heads, distal heads. Palmaris longus is special. Okay, it is a wrist flexor. It also helps as a weak elbow flexor or weak radio or a humeral ulnar flexor. Okay, some people don't actually have this muscle. All right, I want you to pause the video, look at yourself right now. Oppose both your digiti minimi or your 5th digit and your pollicis or your thumb, and then flex your wrist. If you can see that tendon, that palmaris longus tendon, you have it. If you look and you don't, sorry, you don't have palmaris longus. You're one of the few that just doesn't. All right? Some of the conditions we see with these flexors, and they all have a very similar pattern where they move distally onto the hand. Okay, they all move distal against the carpals in order to reach down to the interphalangeal joints. You've probably heard of carpal tunnel syndrome. Carpal tunnel syndrome is an inflammation of that space underneath that transverse ligament, that tendinous sheath where all of those muscles run, as well as your medium nerve that innervates these muscles and allows sensation within our hands. And this allows some vascularity. This is kind of our path, our tunnel into our hand. Okay, if you're sitting in extension for long periods of time, people typing, you're constantly doing a flexion motion while you're in extension. You're putting a compressive force on that carpal tunnel. Over time with repetitive use, okay, often desk jobs, get carpal tunnel syndrome. You may have to have surgery, or you may have to splint in order to allow that inflammation to calm down, to subside. So I recommend if you're sitting on your computer right now and typing like this, fix it, get it back to a nice neutral wrist position to allow, and then get up and move around. Don't sit there and type for hours and hours on end. If you don't have to, elevate your wrists if you really have to be in that position. If you or someone you know is constantly typing, maybe get some kind of ergonomic assist. Maybe it's just a towel, something to put underneath your wrist so that you can type from a more neutral anatomical position. And that's it for our wrist and hand.